Neuropathy appears because sugar begins to destroy the myelin fiber of nerve endings. This can lead to abscess, phlegmon, osteomyelitis, or the appearance and spread of gangrene, a symptom that tells us that something is wrong there. This is what makes us pay attention to it. Diabetic foot is a very interesting pathology. Pathology, which, as a diagnosis, is exposed only when there are some trophic lesions on the foot. If a patient has diabetes mellitus and feels numbness, burning, tingling, various types of leg cramps, this is not a diabetic foot. This is a diabetic neuropathy. Neuropathy appears because sugar begins to destroy the myelin fiber of nerve endings, directly disrupting sensitivity and conduction up to motor function. This is not yet diabetic foot syndrome. This is just a diabetic's foot. Since the patient loses sensitivity, the foot begins to suffer from additional, unnecessary, dangerous influences. For example, a patient may step on a nail and feel no pain. Due to the impaired biomechanics of the foot, corns may occur. The patient often steps on it and does not feel pain, as is the case with diabetes mellitus. A pressure ulcer may appear in this place. Here, a pressure ulcer is diabetic foot syndrome. These are the main symptoms that a patient with diabetes mellitus and with long-term loss of sensitivity in the legs faces. Diabetic neuropathy is a type of nerve damage. Since the nerve endings are damaged, the myelin fiber is damaged. Deformation of the foot occurs. Hammer-shaped, claw-like fingers may form. This occurs due to damage to the nerve endings. The toes are pulled up to the foot. Normally, the patient walks on pads. The foot is adapted to offensive loads. At this stage, the patient steps on his toes. There is little subcutaneous adipose tissue. There is no depreciation. This can lead to corns and calluses. At the same time, the patient does not feel any pain symptoms and naturally does not go to the doctor. And in these places, in the future, pressure ulcers appear. Any wound, any cut is an open gateway for infection. Infection can lead to abscesses, cellulitis, osteomyelitis, or gangrene. Treatment at this stage is only operative. However, at this stage of prevention, to prevent all of the above, the patient must develop the habit of examining his legs every evening. After all, he has no pain. Pain is not a disease. Pain is a symptom that tells us that something is wrong. That makes us pay attention to the problem. Patients with diabetes mellitus unfortunately are deprived of these sensations over time. Therefore, it is necessary to examine the legs every evening with a mirror or with outside help. This is already the first stage in the prevention of complications and surgical interventions. At the stage of selection and formation of the correct individual orthopedic insole, the biomechanics of the foot change, which means that points of additional unnecessary pressure are relieved. When wearing orthopedic shoes, the patient can also change the biomechanics of the foot. This is the prevention of further complications, problems, and surgical interventions. At the stage of wearing an orthosis, the shock load is softened. Prolonged pressure at a certain point is softened, which means that the likelihood of hyperkeratosis or callousness decreases, which means that the percentage of ulcerative defect occurrences decreases. We can say that wearing orthopedic shoes, correct orthopedic insoles, orthotic options that soften a certain area is a method of prevention, further amputation of the lower extremities, and further disability.